Good morning. I am Professor Titilayo Adeyemo, a specialist in Haematology and blood transfusion with the College of Medicine, University of Lagos and the Lagos University Teaching Hospital. Today is April 17th and it's World Hemophilia Day. We will be talking about hemophilia. Hemophilia is an inherited bleeding disorder in which blood does not clot. And that is because there has been changes in the gene that gives instruction for the liver cells to produce clotting factors. If these clotting proteins are not produced, the blood will not be able to clot, and the individual will have a predisposition to bleeding, easy bruising, especially following surgery and injuries. What causes hemophilia? As I said, it is an inherited bleeding disorder. There is a genetic changes or genetic mutation in the genes that codes for the production of clotting proteins. There is also another type of bleeding disorder which is also very common. It is von Willebrand's disease. And von Willebrand disease is found in 1% of the population. Hemophilia is found in 1 in 10,000 births. So, with a population of 200 million Nigerians, we expect to have people with hemophilia, about 20,000 people living with hemophilia. What is the presentation? How do they present? Because it's an inherited bleeding disorder in which the individual lacks a clotting protein, and there are different types of clotting protein. The most common clotting protein that is affected is the factor VIII, and people who lack factor VIII will have hemophilia A. There is also another clotting protein called factor IX, and people who lack factor IX would have hemophilia B. For the von Willebrand disease, people who have von Willebrand disease lack the von Willebrand factor. All these proteins are necessary to form blood clots, but when people lack these proteins, they do not form clots. The presentation is usually soon after birth. People who have hemophilia can present with swelling or hematoma because they've had blood collection under their scalp, especially if they've had a traumatic birth. If a baby has had a traumatic birth and has a defective gene to produce clotting protein and is an hemophilia, they're going to have blood under their scalp and going to have swollen scalp. Another presentation is at circumcision. Prolonged bleeding following circumcision. People who have hemophilia, because they lack the protein to form blood clots, they get to have the circumcision and they cannot just stop bleeding. And this is a very common presentation. And we want the public to know, and the healthcare workers to know, mothers and fathers to know, when you have a child who's had the circumcision and continues to bleed for days and days and days after, you need to have that baby checked because it's likely to have a bleeding disorder, hemophilia. Another presentation is if this is not diagnosed soon after birth, and then the child starts to erupt it. At the point of tooth eruption, they bleed a lot because they cannot form clots. And when they start to crawl, they start to bleed, they start to have bruises, swelling, and they start to have swelling in different parts of the body. They start to bleed into the joints, especially the elbow joints and the knee joints, they present with swollen joints and pain. Another common presentation, which is also often overlooked, is if all of these things are not identified and the individual is not evaluated and treated, especially in women, is heavy menstrual blood flow. When women have heavy menstrual blood flow, they should be evaluated for a bleeding disorder. It could be hemophilia, it could be von Willebrand's disease. If they are not evaluated, they have a high chance of having postpartum blood loss, heavy blood loss during delivery. And we know that in Nigeria, postpartum hemorrhage, heavy blood loss around the time of delivery is one of the leading cause of maternal deaths in Nigeria, and this is from a bleeding disorder. So these are all the presentations that people with bleeding disorder would have, hemophilia or von Willebrand's disease. So there is a need to evaluate people who present with these symptoms. prolonged bleeding post-circumcision, prolonged bleeding following tooth eruption, easy bruising, swelling joints, swelling painful joints as they grow up, every menstrual blood flow, and especially also when they've had an history of postpartum hemorrhage following the first birth. They are high risk for having postpartum hemorrhage following subsequent birth, so they need to be evaluated for hemophilia. So what can we do? How do we manage hemophilia? We have known that it is because they lack a clotting protein. These clotting proteins are now available for them to be used. There are two different ways we approach treatment for hemophilia, and it also depends on the severity. Some people have very severe disease. If we do not give them the protein that they lack, they have a high risk of having serious bleeds or life-threatening bleeds. Now I talked about their presentation and that they bleed easily, especially spontaneously, without having injuries they bleed, or they bleed easily following an injury. Even sometimes the injury is so innocuous, okay, they do not even know, they cannot even remember that they've had this injury, but they are having this prolonged bleeding. For those of them that have severe hemophilia, moderate severe hemophilia, they have to have what we call prophylactic factor replacement, prophylactic therapy. They have to be given this factor that they lack, okay, at periodic intervals. At intervals, we give them sometimes 2 times a week, sometimes 3 times a week. Some even need to have them daily so that they do not have bleeding episodes. For those that have mild hemophilia, we tend to give them what we call on-demand treatment, because for those that have mild, what it means is that they have a little of these clotting factors, they just don't have enough. So what happens is that spontaneously they do not bleed. But when they have an injury, sometimes the injury may also be no cause, they bleed heavily and they bleed for a prolonged period of time. So for those categories of people, we tend to wait for them to have the bleed and treat them as soon as possible following the bleed with the factor replacement. But for those that have moderate severe disease, you need to give them this factor replacement to prevent their bleeding, or otherwise they are going to lead a very poor quality of life with recurrent bleeding from different parts of the body, including sometimes bleeding into the brain, bleeding into the throat, bleeding into internal organs can all happen, and these are what we call life-threatening bleeds. Because we do not want them to have life-threatening bleeds, we need to give them this treatment as before they bleed, and we call it prophylactic treatment. Now, what is available in terms of care and support? We have 13 hemophilia treatment centers in Nigeria currently. We are hoping to continue to work with the Hemophilia Foundation of Nigeria, which is a national member organization of the World Federation of Hemophilia that has been established in Nigeria to support the care and treatment of people living with hemophilia. We work with them, we are working with them, and we are working hard to make sure that we have an hemophilia treatment center in every state of the federation. But currently, we have at least 13 hemophilia treatment centers. So people who have had symptoms that suggest that they may have hemophilia, I would recommend that they visit this hemophilia in this 13 hemophilia treatment center, and the Lagos University Teaching Hospital is one of the hemophilia treatment center, to be evaluated and to be put into a treatment plan. There is also other support. We have the hemophilia support groups, okay, that meet every 2 weeks. Okay, people who have hemophilia, who have the same issues, they meet at regular intervals, discuss their problems, work on advocacy with the government to be able to support with treatment. Because the treatment here is very expensive, and we are depending now on the humanitarian aid of the World Federation of Hemophilia to get this protein, to get these clotting factors to be used for replacement therapy. Okay, but with more people involved, with more advocacy, we will also be able to get our government committed, okay, to supporting the care of people with hemophilia. It is not a curable disease, but it is a very manageable disease, and people with hemophilia can lead normal quality of life as long as they are in a treatment and care plan. Thank you all very much.